Early initiation of short-term emollient use for the prevention of atopic dermatitis in high-risk infants, the STOP-AD randomized controlled trial. In 2021, a Cochrane review and meta-analysis concluded that regular emollients during infancy probably do not prevent eczema and probably increase local skin infections. These were based largely on two very large trials, the PreventEDAL study and the BEAT study, where skin barrier protection had been in place from before 2 weeks to 8 months or 12 months, but the impact on atopic dermatitis rates was negative. Our study was already underway at this stage and was based on the observation we had made that transepidermal water loss increased from birth to 2 months and then stabilized to 6 months, suggesting there may be a very short-term window between birth and 2 months when the skin barrier is changing rapidly and in which an intervention may have a maximal effect. So our study had started already and was well into recruitment of high-risk infants one-to-one to intervention and control using daily specialized emollient use with a donated Aveeno Dermexa product from Johnson & Johnson versus standard skin care with allergy and eczema outcomes assessed at 6 months and 12 months. The primary outcome at 12 months, the cumulative incidence was met with a 29% reduction of atopic dermatitis at 12 months in the intervention group in blue here compared to the control group in yellow, with relative risks for point prevalence of 0.53 and 0.7 for the cumulative incidence in the control intervention group. This is shown graphically here in a Kaplan-Meier study showing separation really quite early between the two groups from about 4 months up to the age of assessment at 12 months. So the study design is as shown previously, and the results are summarized in the bottom panel with age of onset of atopic dermatitis, less than 6 months in yellow, after 6 months, or present at both time points in red, showing a significant difference in the proportion of infants with particularly persistent dermatitis in the control group compared to the intervention, with the relative risks shown on the right-hand side to be strongly in favor of this short-term, well-tolerated intervention with which there was very few safety signals, with just one child withdrawing from the control intervention group due to adverse reaction to the cream. So this is a well-tolerated, short-term, highly family-friendly intervention. Our conclusion is that short-term emollient use in the neonatal period is associated with decreased atopic dermatitis incidence in the first year of life.